If you have really strong feelings about birth, you're gonna have to set those aside. Hey guys, I thought I would talk to you about my labor and delivery clinicals and help you think about, should I do labor and delivery? Is a labor and delivery nurse job a job for me? And first off, I'm telling you my thoughts just from my experiences of 3 births and 5 shifts at I believe level 3 maternity ward, which means they take high-risk pregnancies. First off, I feel like every day is going to vary day to day, and my med-surg rotation was at a very, very small hospital with very low patient loads. But I feel like compared to what the average med-surg patient load sounds like, labor and delivery to me seems like it's a little less go, go, go. Now that's gonna totally vary depending on your day and your patients. But at the level 3 place I was at, if you had laboring moms, they tried not to give you more than 2. If you had mother-baby couplets, I believe they tried not to give you more than 4. You know, it just varied depending on the severity of the amount of needs that a patient had, how many patients you had. I feel like with med-surg, you can end up with way more. I don't know. Like I said, I was at a very slow med-surg hospital, so for me, the med-surg caseload was way lighter than these labor and delivery nurses, but the labor and delivery floor I was on was understaffed and I felt like they were doing okay. So if the amount of work med-surg seems like you can handle it, I think you can handle labor and delivery. Another thing about labor and delivery is it's a very specialized field. There's a lot of acronyms and things you have to learn just for labor and delivery, but I feel like if that's what you want to do, you're gonna get it all. There's always jobs available in labor and delivery. People are not gonna stop giving birth. When the pandemic happened and they stopped all non-essential surgeries, that doesn't stop labor and delivery. It's always gonna be there. That is a job that will always exist. Now, I had home births, I've talked about that before. For the birth of my 3rd child, I had a labor and delivery nurse as my doula. So she found working in labor and delivery was very frustrating for her. She didn't like how many Friday scheduled C-sections she saw. If you have really strong feelings about birth, you're gonna have to set those aside, because when you go in there as a nurse, you're the nurse, you're not the doctor, you're not the patient. You don't call the shots. So if you have really strong feelings about what's best for laboring moms or what's best for babies like breastfeeding, and it's really gonna upset you to see people making the wrong choices, or it's really gonna upset you when a doctor says, they're far enough along, I have plans this weekend, let's schedule the C-section for Friday. If that's gonna upset you, maybe labor and delivery is not a place you're gonna feel fulfilled in, because you're gonna see people make choices that you don't approve of. I watched a mom with HIV refuse a C-section even though vaginal birth increased the risk of transmission to her baby. I didn't agree with that at all, but I had to help support her through that. You're gonna see things. I've watched parents choose to supplement with formula while they were breastfeeding without any very good reason, and you can't just be like, well, you can't do that. Like, you're gonna have to be okay with other people's choices you don't agree with. That wasn't really a problem for me. People do things all the time I don't agree with, so that wasn't too difficult, but I also wasn't doing that day after day after day. Another thing, if you're very pro breastfeeding and VBACs and, you know, trying not to intervene, because I did watch interventions cause interventions. I did see the cascade of interventions with a laboring mom. I would suggest looking at hospitals that don't take high-risk births, because high-risk hospitals, they're used to doing C-sections, they're used to intervening, and it almost, I feel like it becomes easier to intervene even when not needed, because that's what they do. You know, if you have a backache, if you go to a surgeon, you're a lot more likely to get recommended that you need surgery than if you go to a physical therapist. Now, if I had physical therapists say Raylan maybe needs surgery on her foot, Yep. Have I had surgeons say, it's up to you, we could do surgery or we could wait? Yeah. So I'm not saying it's like a for sure thing, but when you go to a high-risk hospital, you're more likely to see interventions, even for yourself as a pregnant patient. If you're low risk and you go to a low-risk hospital, you're more likely, I think, to have a vaginal birth than if you're low risk and you go to a high-risk hospital. They're just, surgeons do surgery, physical therapists do therapy. So if you're very pro VBACs, and although that might be considered high risk, but if you're very natural childbirth, low interventions, I would suggest you don't work at a hospital for high risk moms, because you're gonna see, I think, more interventions that aren't always necessary, but they have the ability to do them, they're used to doing them there, they're more comfortable doing them there, and so they'll just jump to interventions a little quicker, I think. Gross factor. For me, I wasn't interested in labor and delivery because, I'm just being honest, guys, it's kind of gross to me. It's a lot of bodily fluids. It's checking people's pads for lochia after they've given birth. Birth is messy. People poop when they birth, and there's a lot of liquid and blood, and babies do not come out clean. If that kind of stuff kind of is not your thing and grosses you out, there's other nursing jobs, I've talked about it before, guys, there's other nursing jobs that have a lot less gross factor. After a mom gave birth, they gave her so many drugs to stop hemorrhaging, and she just had liquid stool, and I changed bedpan after bedpan after bedpan, helping her, because the stuff they gave her to help stop the bleeding, it just caused her to have really bad diarrhea, runs, cramping. So yeah, there's that. Emotionally, it can be hard to deal with, not just if you feel like, oh no, they're formula feeding and they don't have a good reason, but I saw DCFS was involved in multiple situations for various reasons, and mothers laboring with no support person around. Just emotionally, the situations people were in was difficult there. I feel like that could really get to a person long term. So it's an emotional job. It's a gross job. I don't think it's any more work than a med-surg job, maybe less in some ways. You will learn a lot. I feel like you can very quickly become a specialist in a nursing field that there will always be a demand for. You will have a job almost anywhere you move in America. Closest laboring hospital near me is 30 minutes away, but almost anywhere you live in America, there's going to be labor and delivery nurse jobs available. So that's my experience with labor and delivery and postpartum. Did clinicals in both areas. They were really like right next to each other. I think it's a great fit for some people. I think that it's not a good fit for me. I knew that going in. I still feel that way, but it's not as crazy there as I thought it was going to be honest. And I was at a place that was very short-staffed, and I felt like it could have been a lot more intense than it was, really. Again, I was only there 5 days. I did not see by any means what happens, you know, all the time, what's normal. In just 5 days, you just get a small taste of it. But that was my experience. I saw one birth in 5 days. Like I said, I was on the postpartum area a lot. I listened closely to the chatter and heard what was going on in other rooms. Definitely saw another mom that she would have given birth in a couple hours probably after I left. Definitely watched people labor as well, though. It's an interesting floor. I can see why some people love it. I can see why some people stay there long term. So hope that helps. That's kind of my summary of what labor and delivery was like, and I'm gonna go in and get some groceries, guys.